Welcome to this presentation on infections. This presentation is prepared by Dr. Chris Hendricks, a faculty member from the College of Nursing and Professional Disciplines at the University of North Dakota. The objectives for this presentation are to understand the chain of infection, identify treatment of infections, identify ways to prevent and protect ourselves from infections, and to understand the long-term effects of COVID-19. The National Institute of Health defines infections as the invasion and growth of germs in the body. The germs can be bacteria, a virus, yeast, fungi, or any other microorganism. The infection can be in any part of the body and either be localized or it can spread throughout the whole body. The picture of the chain of infection is from the Center for Disease and Prevention. It shows how the chain of infection works. There are 6 things needed for an infection to occur. The first thing needed is the microorganism, or the germ. Then there must be a reservoir or a source where the germ can live and grow, such as in other people or animals. Germs can live and grow in the soil or in food or water. The third step is how does that germ leave where it lives. This is called the portal of exit. The germ can exit its source by someone who has the germ sneezing or through body secretions, such as saliva or feces. Once the germ leaves its reservoir, it needs to get into the other person. The fourth step is called the mode of transmission. The germ can be transmitted from one person to another by direct transmission or indirect transmission. Direct transmission can be airborne or droplet, such as breathing in when someone sneezes or is coughing. It can also be a needle stick injury. Indirect transmission can be through food or water or contaminated equipment. The germ is now out of its home and comes in contact with the host. This fifth step is called the portal of entry. How does the germ enter the host? The germ enters through any body opening, the mouth, eyes, urinary tract, or respiratory tract. It can enter through a cut in the skin. The last step is the susceptible host. Once the germ enters the host, that host is at risk for infection. The risk of infection can depend on the person's immune system. If they have a strong immune system, they may be able to fight off the infection. If the person is elderly or very young, their immune system may be compromised, making the person more vulnerable to an infection. Examples of susceptible hosts are patients, healthcare workers, elderly, and/or infants and children. To prevent infections is to make a break in the chain of infection. The number one way to prevent infections is proper hand washing. Stay up to date on vaccinations, cover your mouth when coughing or sneezing, and then of course, wash your hands after coughing or sneezing, stay home when feeling sick, and cleaning and disinfecting the environment. According to the Centers for Disease Control and Prevention, there are 2 tiers of precautions used to protect healthcare workers and others from infections. Tier 1 is standard precautions, and Tier 2 is transmission-based precautions. Standard precautions are used for all patient care. However, they cannot prevent all types of infections from spreading, but they can help prevent infections from occurring, as well as help the healthcare worker and others from contracting the infection. Standard precautions include hand washing and using proper personal protective equipment, or PPE. Proper personal protective equipment can be masks, gloves, gowns, and eye protection. Depending on the type of infection will determine what type of PPE to use. Other standard precaution methods are proper handling patient equipment, such as bedpans and urinals, by wearing gloves when emptying the bedpan or urinal. Proper handling of patient fluids, like saliva, vomit, urine, or feces appropriately by use of the proper PPE. Proper handling of patient items such as linens or clothing, by not holding linens or clothing next to your body, and following safe injection practices when handling sharp items such as needles. Sharp items need to be placed in secure puncture containers. Transmission-based precautions is the second tier of precautions and incorporates the standard precaution and adding any additional PPE and/or isolation precautions. If isolation precautions are indicated, the type of infection will determine what type of isolation needs to be in place. Usually, if isolation precautions are indicated, the patient will be in a room by themselves to prevent transmission of the infection to a roommate. Often, if a patient is in isolation, disposable patient items are utilized, such as plastic silverware and paper plates. The first step in treating infections is to determine what type of infection it is. This can be done by laboratory tests, such as blood tests, urine tests, throat swabs, stool samples, or even a spinal tap. The provider may also order some imaging tests, such as a chest X-ray, to determine if it is a respiratory infection, and finally, a biopsy may be taken to see what type of infection it is. An example of this could be taking a biopsy of the lung tissue to see what type of fungi is causing pneumonia. Once the type of infection is determined, then the provider and patient can decide on the treatment. If the infection is a bacterial infection, an antibiotic can be used. There are certain types of antibiotics that work on certain types of bacteria. There are some antiviral treatments that can be used if it is an antiviral infection, but not all viruses can be treated. Some of the viruses that can be treated are HIV/AIDS, hepatitis B and C, and there are some viral treatments for influenza. If the infection is a fungal infection, there are some antifungal medications, such as an antifungal cream for skin or nail fungal infections. COVID-19, or coronavirus, is an infectious disease that is caused by the SARS-CoV-2 virus. It became a pandemic in 2019. For most people infected with COVID-19 will have a mild to moderate respiratory illness, and most recover without requiring any special treatment or long-term effects. However, some can become seriously ill and require medical attention, and some died as a result. Some people infected with COVID-19 may have some long-term effects, called long COVID. Long COVID-19 can include a wide range of symptoms that can last weeks, months, or years. Long COVID is identified at least 4 weeks after the initial COVID infection. There is no test to determine if someone has long COVID. Symptoms can include general symptoms, such as tiredness or fatigue that interferes with daily life. There can be respiratory and heart symptoms, such as difficulty breathing or shortness of breath. A persistent cough, chest pain, or heart palpitations may occur. There can be some neurological symptoms, such as difficulty concentrating, sometimes referred to as a brain fog, headaches, sleep problems, dizziness or lightheadedness, pins and needles, feelings in the extremities, a change in taste or smell, or depression or anxiety can also be some of the neurological symptoms. A couple other symptoms may be diarrhea or stomach pain, or joint and muscle pain. There are certain people or groups that may be more likely to have long COVID. Those persons or groups are those who have experienced more severe cases of COVID-19. Those who may have had underlying health conditions prior to contracting COVID-19, those who did not get the COVID-19 vaccine, or those who experienced some multisystem inflammatory syndrome during or after their COVID-19 illness. There are no immediate answers or solutions for living with long COVID. Treatment is based on the symptoms the person is having and maintaining a good quality of life. Thank you for listening to this presentation on infections and long COVID. These are the references used for this presentation.